Hi, I'm Amy Rose now with KDHE Office of Communications. Welcome to another episode of The Dispatch. Today we're here with Lindsey Webb with our Bureau of Epidemiology and Public Health Informatics. Lindsey, can you tell us what you do?
I oversee the Foodborne, Waterborne, and Zoonotic enteric disease programs for KDHE.
And what is the purpose of the Foodborne Disease Program here at KDHE?
The purpose of the Foodborne Disease Program at KDHE is to monitor foodborne illness in Kansas and to respond to outbreaks locally and nationally that affect Kansas residents. We work closely with our partners at the Kansas Health and Environmental Labs and in the Food Safety and Lodging Program at the Kansas Department of Agriculture to identify outbreaks and their causes and to implement prevention and control measures.
Can you describe the difference between what the Department of Agriculture does and what we do here at KDHE?
Yes, the Department of Agriculture is responsible for all of the food establishment inspections and any licensing that's associated with that, and we respond to any illnesses or any outbreak investigations.
Okay, and what is a common cause of a foodborne illness?
There are many causes of foodborne illness. Some bacteria, like Clostridium perfringens or staph, can produce bacterial toxins that grow rapidly when food is held at improper temperatures. And these are what typically cause what people think of as food poisoning, and they'll cause illness within a couple of hours. Norovirus, which is what people commonly think of as the stomach flu, is also foodborne but can be spread person to person and is highly contagious, and so we see a lot of that this time of year with large gatherings and holiday events. And then bacteria such as Salmonella, toxin-producing E. coli, and Listeria are typically associated with illnesses that can occur days to weeks after being exposed to a contaminated food. And it's important to be aware that while foodborne diseases are typically self-limiting and cause gastrointestinal symptoms, in some cases they can lead to severe complications like hemolytic uremic syndrome with kidney failure or systemic infections and meningitis.
Okay, so in working with some of these outbreaks, what are some of the lessons that you've learned from those?
There's some pretty clear lessons that we've learned from the outbreaks that we've investigated. Proper food handling is important, so anybody who's experiencing any symptoms of illness should not be involved in food preparation at all. We've seen outbreaks caused by ill food handlers. For example, there was one caused by an individual with norovirus who was cutting pineapples, so that's something you don't think of as typically causing illness, but prepared for a large group of people, it can lead to an outbreak. And then proper hand washing is always important because you can spread disease even if you're not experiencing symptoms of illness. Another important food safety component is appropriate hot and cold holding of food. It's important that cold foods are held below 41 degrees Fahrenheit and hot foods are held above 135 degrees Fahrenheit. In between that is what we call the danger zone, where bacteria can grow and produce toxins, and we see many outbreaks associated with these, especially in potlucks and catered events and buffets. And then also ensuring that cooked foods are cooled properly. Putting hot foods into a refrigerator that's not equipped to handle that can raise the temperature of the air inside the refrigerator to unsafe levels.
So if you suspect that you've gotten sick from something that you've eaten, what can you do?
Well, if you are experiencing illness, you should see your physician or your healthcare provider for treatment and diagnosis. And if you suspect that your illness may be a part of a foodborne disease outbreak, you can call the Epidemiology hotline at 877-427-7317.
Well, we have a question that's come up a few times is, are you supposed to rinse off your chicken before you prepare it?
No. That is, you want to make sure that all of your surfaces are clean and your hands are clean and there's no cross-contamination on those surfaces, but it is better to just cook the chicken without rinsing it, and that way you're not spreading the germs that are already naturally on the chicken to other parts of your kitchen and to your hands.
All right, well, very good information. Very good to know. So everybody stay safe this holiday season, and we'll see you on the next episode of The Dispatch.